Hi, I'm back. Okay, so in this video, we're going to do the wound station. Um, like I said in the updated video about where I got some more study resources or whatnot. Um, uh, so things are going to be a little different. Like I watched a video how they want us to perform the wound station, the wound change. So remember, I was like, oh, I don't know when I'm supposed to put my gauze, 4x4 gauzes in this thing or whatnot. So the trays that they have at the site, looking at the video, the gauzes are already going to be in the package in the tray. So you open up the packet and it's supposed to already be in there, and you just pour the solution in there, and that's that. I won't be opening up my packets and dropping it all on the sterile field with the sterile gloves. I think it's going to be enough space in there where I could just open my items and sit them on the table. So that's what I'm going to do. And so just to give an idea of what it's going to be like when you get there, when I watched the video, they said that it will be in a conference room, and it will be other people other than myself in there testing, but it will be one person per station. So that's good to have a little visual of how it's going to be, how the room is going to be set up. So, you know, they have those long tables or whatnot, and that's what you'll be using for your station. So you'll have plenty of space. I'll have plenty of space to do what I have to do. What else that I wanted to note? So anyway, so here's the thingy. I don't know if you can see it on here or not. Oh, maybe not. Nope. Let me see. Well, anyway, it's Nursing 702, Navigating the cpne, and on here it has the nursing stimulation lab, application of a sterile technique, and then it has the wound, the pick, the catheter. Then it has the overview of applying the sterile technique when performing wound care. And so you click on that and you can read that and the steps or whatnot. And then it has an example of applying sterile technique when performing wound care from a nursing stimulation laboratory. And then it has the video, which shows you exactly what you're supposed to be doing. So it's nothing to wonder about or anything. It's going to show you exactly. So you need to, it's okay to watch other people's videos for motivation or whatnot, but when it comes to studying, you don't want to study off watching someone else's video who, like me, has to go and test. So you have the resources here to make sure that you're watching the correct video and you're doing the right steps. I'm uploading these videos because I talk about it, and I just feel like it will help someone or motivate someone with this program and give them something to expect, look forward to, and also because I want to document my journey and also watch the videos and watch myself and make some changes if I need to. So that's that. And just, I'm going to click on overview of applying the sterile technique when performing a wound care, just to let you guys know what it's saying as far as a step like wound dressing, student learning outcome, nursing judgment, spirit of inquiry, assessment points to consider. So it tells you what you're supposed to do: review the medical record to determine sterile procedure to be performed, document procedure to be performed based upon information contained in the medical record. And so you will get that. medical record from the CE, and you would read it so you figure out, am I doing a PIC, a catheter, or a wound? And then once you figure it out, you will check which one you're going to do, and you will hand that sheet of paper back to the CE. And if it's the correct, if you pick the correct thing, then you would proceed. Then you will select your supplies and the mannequin needed for the procedure, perform hand hygiene, and verbally identify the patient, comparing two pieces of information on a patient's identification band against the medical record. So you don't want to just look at it and say it in your head. You want to verbally speak that. Implementation points to consider: manage your space on the table so you can open supplies and your gloves without contamination. You should not reach over sterile field. That's why I would put my sterile items in front of me and leave space here for whatever else. So I'm not reaching over anything. I'm going here, going here. Position a mannequin to allow easy reach for removal and application of dressing. Consider which hand is your dominant hand as you arrange your supplies. Open allotted supplies using principles of aseptic technique. Any inner package wrapper between the outer edge and the blue line is considered not sterile. Don clean gloves to remove the old dressing. Inspect wound bed. Note drainage and condition of surrounding skin. Dispose of dressing in an appropriate receptacle. Remove clean gloves. Perform hygiene. Prepare packaging with prescribed solution. You must pour solution before you don sterile gloves. Don sterile gloves. Once you have donned the sterile gloves, you can touch sterile items. Cleanse wound without contamination of the sterile gloves. Pack the wound. My last video, I cleaned the wound with clean gloves. So now I know that I will take the dressing off, dispose of the dressing in the gloves, and I would don sterile gloves and then proceed to clean the dressing without contaminating my gloves. Clean the wound without contaminating my gloves. The gauze must fit sufficiently unfolded to create a loose packing that will cover the wound bed. A correctly packed wound has packing close to edge, and gauze does not extend beyond the edges of the wound to the surrounding skin. I don't know, let me see if you can see. Oh, you can see. So, like that. These are examples of incorrectly packed wounds. The gauze that extends over the surrounding skin. Okay. This is an example of incorrectly packed wound. Illustrate gauze that does not completely cover the wound bed. Okay. Cover packing with sterile 4x4 and sterile ABD pad. Remove gloves. Perform hand hygiene. Tape dressing securely. It is not necessary to tape the dressing on all sides. Label dressing with date, time, and initials written on a piece of tape and attached to dressing. Do not write on the patient. Discard your supplies. Complete appropriate documentation. TLC PC. So that is the type of wound, the location of the wound, the condition of the wound bed, the presence or not of drainage, and the condition of the surrounding skin. So that's that. And then here's a sample of documentation. Wound dressing last changed 6 hours ago, so new dressing indicated per physician's order at 17:50, 5:50 p.m. Removed old dressing from left lower leg, diamond-shaped surgical wound, beefy red wound bed with granulation tissue noted. No drainage, surrounding skin intact without redness. Using sterile technique, wound was cleaned with sterile 0.9% sodium chloride on 3 4x4 gauzes and packed with a 4x4 gauze moistened with sterile 0.95% sodium chloride. A dry sterile 4x4 gauze dressing and ABD pad were applied over the wound. That's it. And then it would be complete. So I don't have my aspire yet. I still didn't find that. So, but I'm going to go ahead and get started. And just for me, I will ask at the start of my testing, or maybe I'll ask somebody else, or call the facility, call Excelsior and ask them, is there such thing of TMI, too much information? Because even though it doesn't state that you have to talk to the patient, that's probably more in the patient care scenarios, but I just would like to do it just to stay in the habit of making sure that I do it, as far as saying this, what I'm explaining, what I'm going to do, and that it's a physician's order, and also asking about pain and comfort or whatnot. I just want to do that with every station, just so I could, I'm used to doing it at work or whatnot, so I just want to do it, and I just hope it's not TMI and they'll say, well, you said this or you asked that, and that wasn't part of this one of the steps. So I'll find out. But anyway, so what I'm going to do is, so when I'm thinking of doing this, even so I'm in a conference room or whatever, I'm not in a residence or patient's room. So when I gather my equipment and as I do my station, I'm going to put myself in a mind frame as if I'm at a facility and I'm about to do a wound change. So first thing I would do, being that it's at a facility, is I would gather my equipment because I'm outside the room. So I know that I would be gathering my equipment before I even identify the patient or resident. So that's that. So, and then I might be talking to someone, getting report, or talking to someone about at the nursing station about what I'm about to do as far as a supervisor or something. You never know. So incorporate that as why I'm talking to the CE. So anyway, so I'm talking to the CE. She gives me the MIRE and then the medical record. I read it, figure out what I got to do, blah, blah, blah. Oh, it's time to change, per physician order, it's time to change the wound. So check the wound, give it back to her. So she has it. She said, it's right, you do have to get the wound, change the dressing on the wound. So now I'm going to gather my equipment. So, and I'm going to go in order to what I'm going to do. So in order to get this this old dressing off, I'm going to need some clean gloves. But before I even use that, I'm going to have to sanitize, clean my hands, and then I'm going to need a tray, and I'm going to need some normal saline, and the clock will be on the table. And then after that, I'm going to need, my gauze are in there, my 4x4, 2 packet is in there, So I'm going to need a 4x4 to place on top. That would be my sterile. And then I'm going to, of course, I'm going to need a pen with my tape for the date and the initials and everything. I'm going to need an ABD pad. And I'm going to need my gloves to even deal with any of that. So, I double check. In order to take this off, when I wash my hands, in order to take this off, I need some clean gloves. I need to have the normal saline in my tray. I gotta have to clean it, and then to pack it, then my 4x4, ABD pad, and of course I need my sterile gloves to do it. So I got everything. 1, 2, 3, 4, 5, 6, 7, 8, 9 items I need to complete this station. That's including the pen and the tape. So wound 9. So I'm gonna visualize wound 9 so I don't forget anything. So I have that. So now I got my equipment, my supplies. Now I'm walking to the residence room. Go in the residence room. Hello, I'm Angela. Can I identify you by looking at your name tag and at your wristband and asking you some questions? And I'm going to compare it to your medical record. Okay, can you tell me your name? Okay, Elaine Dons, right? Can you tell me your birthday? 3/24/81, good. Okay, 2 identifiers, got it. Verbally, wristband, and the medical record. So today I'm going to change your wound dressing per doctor order. So if you excuse me, I'll wash my hands first. So wash my hands. Okay. Come back. Are you in any pain right now? No? Good. Okay, I'm going to adjust the bed to an adjustable height, usually to my elbows. That up there. Blah, blah. All right, got that. So now I will actually open up my items. So here's my gloves. Okay, my 4x4 dry dressing. Slowly open this. We don't want no problems. Slowly open that. And then I'm going to leave that open as I left the gloves open. Here we go. My ABD pad, same thing. Open slowly. And I'm going to leave that open. Make sure it stays open and lays down. And I'm going to get my tray out. Set it there. Pour my normal saline in there. Things that I'm done with, I'm going to put to the side, out the way, that I know I'm not going to use again. So it's out of sight, out of mind. So now, I'm going to clean my hands again. You can't clean your hands too much, in my opinion. Clean my hands. Put the gloves on. Gloves on. Loosen up the edges. Grab everything. Throw it away. away. Oh, I'm gonna throw it away with my gloves. So I actually pinch here so I don't put my fingers under there. I do it slowly so I don't get any splashes. Inside out, and there. Take that one, grab it. My fingers in the inside, in case the outside is soiled. Dump it in the trash. I'll be getting that out the trash. Anywho, so that's that. I'm gonna clean my hands again. I'm gonna look at the wound, see the granulation tissue. The edges are fine. No drainage, no odor, no nothing. It is looking good. Red, beefy. That's it. Well, mine actually is. Look like it has an infection. If it's, or a bone. Stage 5 ulcer. So anyway, it's my hands. So going to my glove, only touching the board, the folded border. My gloves on, only touching that folded border. How that is, I can, well, it fell down, but I could have adjusted it once I got my gloves, other glove on. So now I'll grab my other glove, and I'm only touching the inside now. The inside. I'm not touching this part with my sterile glove because this is sterile, this is not sterile. Put it on. Now, how it's like that, I can touch this and get it right. Get it right, get it right. There we go. Good. So I got that on. I can actually move this out the way also by touching the inside. I can throw that away, or I can just put it to the side. And if it's in my way, which it probably won't be there because of the space, but I'll put that to the side because it's in my way now. Keep my hands above my waist because if I drop it below my waist, it is contaminated. So now I have to clean this wound bed without contaminating my gloves. So I'm going to take it, fold it, and I'm going to kind of have something to grab onto up here like that. So my gloves is not touching it whatsoever. So outer edge, throw that away. Same thing with this one. Outer edge, throw that away. Same thing with this one. I'm kind of just connecting the edges, the little triangles in the middle. One sweep or you'll contaminate. So that's that. So now I'm going to pack my wound, and I am going to open. So, and yesterday I did the folding thing because I watched somebody else's video. Today I'm going to try doing something different after I watched the video on the nursing 720 navigating cpne. Kind of like the idea of just, it's open and just kind of bringing it together. bringing it together like that, and then sitting in the wound, on the wound bed, and figuring it out. You know, it's fluffy, and kind of placing it in there this way, so you can like only pull out what you need to pull out carefully. Being careful not to go over the edges. Like I said, I feel like the wetter it is, the more it will lay for you. And to be honest, I don't like this way, so I probably will be doing a folded one again. But it's in there. It's not going over the edges, and it's there. It's fluffy. Definitely fluffy. Definitely is fluffy. So I'm going to contaminate my gloves to get it and show you guys. It's fluffy, but as you can see, it's not over the edges. But here's a little bit. Look like it was. Yeah, that one is. Oopsie. That'll have to be good enough. But see, this is real tedious. Got to be careful if you want to pass. Careful, careful, careful. What in the heck is going on? There we go. Okay, so act like I didn't do that. So pack that. So now, get the 4x4, drop it, get the ABD, drop it. Now I can take, this will be the best feeling ever when it's time to take these gloves off. You're like, whew, I did it. So, always pinch. I always pinch. Pinch here. Pull off. Fingers in there. Drop it in the trash. As we know, I am going to reuse these, but I put everything in the trash. So, wash my hands. I usually would have did this when I got everything out, but I didn't, and it's okay to do here. So, AB, it's my initials. It is 0304, and the date is 10/4/18. That. I don't have to secure all 4 edges. So we already know I'm gonna go here, down the middle. And I don't think I really want to take all this off, but I will, because that's what the video is for. Practicing, doing everything right. There we go. demonstration video talking about I don't feel like doing all the steps. Haha, what a joke. I ordered my supplies from Amazon. I didn't order it from the Excelsior website. And I don't remember how much I spent either. I didn't keep tally. There's that. Clean up my mess. Oh, I'll wash my hands again. Clean my mess. I didn't set my timer, but we know it is 30 minutes, and I don't think that it took 30 minutes for me to do that. But you never know. So make sure you are setting your timer, at least so you know how long it takes you to do the things. All right, my mess is cleaned up. All right, how are you feeling? Are you in any pain right now? No, I'm good. Excellent. I am going to lower your bed back down. Is it anything that I can get you? No. Oh, cup of water? Okay. I'll be back with a cup of water, or send someone in to bring a cup of water. Just know you'll get a cup of water. Excuse my belly peeking out. Want to see what's going on. So that's done. And I think I would have to say I passed that station. So I will watch the video and I will act as my CE and check off everything that I did and did not do. That's that. And I believe I am about to do pick line station. If I don't, my baby woke up, or I just out of the blue got extremely tired. But my date is November 30th, so I think I am going to do it. Need to. All right, so that's that, the wound station. And I don't think I have anything that I want to say. And if I think of anything, then I'll say it in the beginning of the pick line station. Thanks for watching. Subscribe.